I think this is a common question or misconception is trauma centers are level 1, level 2. There are level 3 and 4, but let's focus on level 1 and level 2 and what this means. So both facilities receive trauma patients 24 hours a day, 7 days a week. So there is no distinction in how injured you are and where you go. I think that's like the most common misconception. What it boils down to is what resources and requirements they have. So we're in Florida, so the Florida Department of Health verifies trauma centers along with the American College of Surgeons. But their requirements are each a little bit different. But I want to, again, broadly tell you what happens here. So both have a surgeon available 24/7 and ED capabilities in emergency medicine and advanced imaging and all the things needed to take care of critically injured patients. However, there are some specific things that fall over here that don't necessarily fall over here. So you need to have an in-house general surgery residency program to be considered for a level 1 verification. So again, here we have 6 surgery residents per year. That's times 5 years. So we have like 30 residents, and then we have the Surgical Critical Care Fellowship, which we also have 3 fellows for which I'm responsible for. So we have like a lot of resources from then an education standpoint, which also then plays into what we do for research, which also all falls into the requirements for level 1 verification. Again, and then just from a resource standpoint, we have neurosurgery, plastics, vascular, CT surgery. We have all of the subspecialists where a lot of times, sometimes at level 2s, you don't have the same resources from a subspecialty standpoint. And then another important factor here is we monitor our community outreach and education to the community, which is very important for level 1 verification as well. We typically see higher volumes. So we see over 4,000 trauma admissions a year at my institution. And let me think what else. So again, there's just a wide range. But again, if you're injured critically, you could go to either of these. This does not determine where somebody who's super injured goes. And again, how do we determine how injured somebody is ISS, which I have a video on, which is the injury severity score. So that's the main difference, though, is in resource allocation for verification of level 1 versus level 2. And then again, there's also 3 and 4 centers out there as well across the nation.